Good afternoon, good morning, welcome everyone, depending where you're joining from today. We'll be getting started here in just a few more seconds as our attendees populate into today's webinar. So thanks so much for joining, and we'll begin here in just a few moments. Okay, well, I know we have a lot to get through today, so just a quick welcome. Thank you so much for joining once again in today's Seizing the Opportunity to Develop Dementia Programs webinar. Just a few logistical announcements before we begin. We do have the live transcription enabled today. You can each manage that individually on your own screen by clicking on the CC button on your Zoom panel and then choosing to show or hide subtitles. Also, the Q&A panel is open today. The Q&A is the best place to put your questions for our presenters and presentation. Also, any comments you have, and then also technical concerns or assistance that I may be able to provide for you. Lastly, since we are using Zoom webinar today, you are automatically muted on audio and video as a participant. So no need to manage your audio video there. You are muted automatically. And once again, if you need any technical assistance, please use that Q&A to let me know. For now, I'll hand things over to Sari Shuman to give us her welcome. Sari, over to you.
Thank you, Shane. And thank you everyone so much for joining us today for the National Alzheimer's and Dementia Resource Center webinar, Seizing the Opportunity to Develop Dementia Programs, Successful Program Funding, Planning, and Delivery. The National Alzheimer's and Dementia Resource Center webinar series is supported by the Administration for Community Living. Shane will get us moving now with the presenter intros, and then we will start our presentations. Over to you, Shane.
Great, thank you, Sari, so much. Just as a answer to a question that came in, today's event is being recorded and will be provided in archival for viewing later on. I'd like to now introduce Erin Long. Erin Long leads the Administration on Aging's state, community, and tribal grant programs dedicated to supporting persons living with Alzheimer's disease and related dementias and their caregivers. The Administration on Aging's Alzheimer's disease and related dementia programs are dedicated to building and expanding dementia capability across the United States through culturally competent education and training on a broad range of dementia-related issues, as well as the provision of direct services through evidence-based interventions. In addition to being responsible for the planning and development of the programs, she provides programmatic guidance and oversight for all program activities, including the National Alzheimer's and Dementia Resource Center. Ms. Long also serves as a federal member of the National's Alzheimer's Project Act Advisory Council on Alzheimer's Research, Care, and Services. She holds a Master's of Social Work degree from Virginia Commonwealth University in Richmond, Virginia. Sari Shuman is a Senior Research Public Health Analyst in the Aging, Disability, and Long-Term Care Program at ARTAT International, and co-director of the National Alzheimer's and Dementia Resource Center, funded by the Administration for Community Living. Most recently, Ms. Shuman's work through NADRC has focused on administering activities of the Resource Center, providing expert technical assistance to the Administration for Community Living and its dementia-focused grantees, and providing dementia-focused educational programming. Ms. Shuman has co-authored numerous reports on dementia-related topics, including care needs and supportive approaches for people living with dementia, translation and implementation of care and services for people living with dementia and their caregivers, and dementia care models. She holds a master's degree in public health and social work from the University of Michigan, Ann Arbor. At this time, I will turn the presentation over to Sari Shuman to begin.
Great, thank you so much, Shane, for your introductions, and Erin and I will get started with our presentation. We'll just go to the next slide and talk a little bit about our goals for today. Shane, can you move to the next slide? Thanks. So our learning objectives for today, what we hope you will leave knowing, we'll understand a little bit more about the benefits of the Administration on Aging, Administration for Community Living, Alzheimer's Disease Programs Initiative, which you'll hear referred to as ADPI, the State and Community Grant Program. And you'll learn more about the role of the National Alzheimer's and Dementia Resource Center, referred to as NADRC, in the implementation of the ADPI grants, and then the benefits of NADRC and the provided expert technical assistance which accompanies grant awards. So as we move to the next slide, just a few facts here about dementia in the United States. I won't read all of the bullets out to you, but the key things that you may already know that are kind of called out on this slide is that while right now there are over 6 million people with Alzheimer's disease and more than 1 million additional people with other types of dementia in the United States, by 2060, it's estimated that over 2 times that number of people will have Alzheimer's disease and related dementias at 13.9 million Americans. The cost of dementia is extremely high. There's a large number of people affected. It's not just the people living with dementia who are affected, it's also their family and community. So the care burden associated with dementia is falling not only on the person diagnosed, but also on the people who live with them and the people who live around them. So that underscores the importance of why we focus on dementia and why we are here and why we have these programs. So as we move to the next slide, Erin will start to talk a little bit about the grants and the funding for them.
Great, thank you. First, I want to thank everybody for joining us today. We're very cognizant of your busy schedules, and we appreciate you making time to learn about the programs that we have. To start off, I just want to give you a tiny bit of background on the Alzheimer's dementia programming that ACL has. We've been funding programs supporting states since 1992, but in 2014, we began providing opportunities for communities. So we've been running the Alzheimer's disease programs initiatives as grant program, as Sari noted. We're going to call it ADPI. Since 2014, these are grants that are there's 2 funding mechanisms, and it's basically one for states and one for communities. We're going to get more detail later, but it's basically to build and expand dementia capable systems in states and communities through the development and implementation and evaluation of pilot programs. It is a sort of understand your community, know what they need. And while we do have some specific requirements that we're going to talk about, you can meet your community where they are and figure out how to provide home and community-based services and supports for people living with dementia and their caregivers. And also a very important component of our program is increasing the dementia capability of the workforce. So, and that would be the paid and unpaid workforce. We also fund the National Alzheimer's and Dementia Resource Center through a contract. And what they do a huge amount of things, but in terms of our grant program, they support our grantees with a team of dementia experts that we're going to learn more about and provide the provision of technical assistance. And they also spend a lot of time developing resources in support of our grant program. And also not only they create these resources and we make them available, even if you're not a grantee, you still have access to them through our NADRC website for the broader general community. And with that, we'll go to the next slide.
So you may be wondering, who is this NADRC? Well, it's not just me, it's not just one person. We have a team that works remotely located throughout the United States. And we come from a variety of different educational backgrounds. Some of us have a background in gerontology or public health, social work, public policy, a wide range of educational backgrounds, all with focus on aging and dementia. And we all have a variety of professional experience. Some of us have worked in the field providing direct services to people living with dementia and family caregivers. Some of us have coordinated local and state dementia initiatives, and some have worked in clinical and programmatic research. So we come from a variety of both educational and professional backgrounds and experience. We also belong to a variety of professional associations, which help us stay up to date on the field, including the Gerontological Society of America, the American Public Health Association, American Society on Aging, and others. The other thing that you should know about our team is that most of us, our team members and our families or friends, have been impacted by dementia in one way or another, which also gives us insight just into the personal impact of dementia caregiving. And we really do appreciate the work that our grantees are doing for people around the United States. So we will go to the next slide where Erin will start talking a little bit about how this all comes together into one program with everyone working together.
And that's really what it all is about, is the expertise and the resources coming from ACL and the expertise coming from the NADRC to provide this wealth of wisdom and insight to get technical assistance to our grantees throughout the life of our projects. And the technical assistance comes in a variety of ways, both from the perspective of the ACL as the grantor and then the NADRC staff in terms of all their expertise. We work with people, we work with grantees individually, we bring them together, we have peer-to-peer learning opportunities, whether it's individuals or, if we have a number of grantees in a certain state, we'll bring them all together so everybody knows what the other's doing. We have webinars like this, and then as I noted before, the experts at the NADRC are always creating tools and resources and reports on important issues that are identified and making them available to the everyone who could benefit from them. And with that, we'll go to the next slide. So just to get a breakdown, there are different requirements for the accessing the funds that are available through ACL. As I said before, we have two categories. There's grants to states, and the funding to the states is basically working with states to expand their dementia capability and streamlining access to the full array of dementia-capable person-centered public and private sectors through promoting community living and independence, and then access to comprehensive, sustainable set of quality services and supports that are dementia capable and innovative, and taking them from the top down, from the states down to the communities. The funding for the communities, they are the grants often end up being very complex, multifaceted programs, but we do require that there are 3 gap areas that everybody must include in their applications. We target providing effective services to persons living alone with Alzheimer's and related dementias in their communities, improving the quality and effectiveness in programs and services dedicated to individuals living with aging with intellectual and developmental disabilities and Alzheimer's or dementia, and those at high risk of developing ADRD. And then also expert consultation and in the delivery of behavioral symptom management and training for caregivers. Next slide.
So as Erin mentioned, the National Alzheimer's and Dementia Resource Center, NADRC, is operated through a contract that was awarded through the Administration for Community Living to RTI International. So the staff that are working at NADRC are providing technical assistance along with ACL, like Erin had mentioned before, and our expertise and technical assistance is offered in a variety of specific topics related to Alzheimer's disease and dementia, grant reporting requirements, the submission process, other topics requested by grantees. We also are working a lot with grantees on the various aspects that you see in the hexagons on the slide, dementia-capable systems and evidence-based and evidence-informed interventions for people living with dementia and their caregivers, and supportive services for people living with dementia and caregivers, and behavioral interventions, training for professionals and caregivers, and those are usually dementia focused trainings, of course, and then program evaluation and data collection and reporting. So as I mentioned before, our expertise in these areas is very broad, And we're able to provide support in all these areas because of that broad expertise and experience. So as we move to the next slide, you'll see the different types of technical assistance that's provided. A lot of times our technical assistance is provided on a one-to-one basis through email, phone, or video conference, where we're talking with the ACL program officer, the resource center staff person that's assigned to a grant, and the grantee, and whoever else they have on the call for that day, for whatever day we're meeting. We also do site visits with the community organization grants. Those are typically virtual in nature, where we take a deep dive into the program and offer specific technical assistance once the grantee is implementing programs into the community. And the other types of support we offer are peer-to-peer support, where we can connect grantees, both past grantees and present, with other grantees who have common programs or interests. We also distribute grantee-developed resources. We have webinars like these. There's a webinar series every year that's focused on various topics related to dementia. And then we also develop many materials that are posted on our website. We'll talk a little bit more about the website in a little bit later in the presentation. We not only have toolkits and reports and consumer guides, but we also have tools that help support grantees in their work once they have ADPI awards, and help all organizations and states in application development for these ADPI awards. So we'll move to the next slide to talk a little bit more about this individualized technical assistance. And in this slide, you see kind of the flow of our work. So when grants are awarded, our team at the Resource Center, we assign 2 people to work on each project. We have a technical assistance lead and a partner. And as the grants are awarded, the technical assistance lead and partner review the grantee narrative application, the budget, and other materials. And then we have a initial meeting with grantees to talk about the planning phase and how we will work with them on their work plan and their evaluation plan to get them moving eventually into implementation. And as we meet ACL and ADRC and the grantee, we talk about what seems to work best for the grantee program, what are some reasons why the grantee might want to use a certain program and not another. And we're able to draw on our prior experience with grantees from many, many years past and current grantees to try and figure out, well, yeah, that seems like it will work really well. Or have you thought about A, B, C, or D in your planning? Different, sustainability options, different ways to reach people in the community, and marketing techniques. So after the planning phase, you move into implementation, where we have the site visits that I mentioned for the community-based organization grantees, and then we have regular meetings and we provide reporting assistance. Sustainability planning is done throughout the planning and implementation phase, so we can really try our best to make sure at the successful programs that you roll out into communities are maintained after the grant funding ends. And then at closeout, there's a final report planning meeting where we help you figure out what all needs to go into your final materials that you submit to ACL. So as we move to the next slide, we thought it would be really helpful for all of you to hear from some of our grantees through some recorded messages that we have. So the first person we'll hear from is Ms. Stephanie Shivers. She is going to talk about the work plan development process, and we'll talk and expand on the importance of evaluation and data. So Shane, can we cue up that video?
I'm Stephanie Shivers, and I'm the Chief Innovation Officer at Caring Kind, a community-based services and support organization in New York City. I've had the great privilege of being awarded and directing 2 ACL ADPI cooperative agreements, and I'm very glad to be able to share a few things from my experience. As a leader in a community-based organization, I know that our livelihood is dependent upon our ability to execute, demonstrate, and communicate the quality of our programs. And in the not-for-profit world, it can be challenging to fund and launch new programs. Limited finances, trained staff, and technical expertise to roll out new programs are real barriers for those of us trying to do good work on a limited budget. The ADI program provides a supportive on-ramp to expand an organization's evidence-based services by providing seed money and technical assistance to pilot new programs. Over the course of a 3-year period, this funding gives organizations like ours the opportunity to choose from a large range of evidence-based or evidence-informed programs to implement with targeted populations. And because the funding is part of a cooperative agreement, ACL also provides ongoing technical assistance throughout that timeframe. The ACL team worked closely with us on refining our work plan, and then they continue to meet with us on a regular basis for guidance, troubleshooting, and general support to implement our program successfully. Another great thing about the ADI program that comes to mind for me is the guidance and funding to do a robust program evaluation through a third-party evaluator. Community-based organizations aren't necessarily great at being able to sustain programs, and I believe it's probably somewhat due to our inability and inexperience to collect data, measure outcomes, and to do a solid program evaluation. Being able to leverage the expertise of both ACL and an external evaluator has definitely sharpened our skills for measuring the impact and effectiveness of our programs. Yes, this is hard work, and there's a learning curve, but ACL has provided the support we've needed to get through it. And this is a critical piece of work where we must build our capacity. We need to have solid data supporting our outcomes so we can advocate for ongoing funding for sustainable programs. Learning how to use data to tell the success of our programs has been an invaluable lesson for me. And now I sound like a data nerd because it's been truly transformational for me to demand solid outcomes from our programs. Now I'm constantly asking, what are we moving the needle on and how do we know? Because if we can't articulate and show the success of our programs through some measurable outcome, we can't know they're actually making a difference. So why should our programs be sustained? Why should they be funded? I strongly encourage any organization or state that's looking to expand their dementia services to seriously consider applying for an ACL ADPI cooperative agreement. We're all trying to do good work in this field, and this funding opportunity and the ACL team can significantly help us advance our efforts. Thank you.
So as you heard from Stephanie Shivers, NADRC staff and ACL work together with ADPI grantees to develop a comprehensive 3-year work plan and an evaluation plan for their dementia-focused projects. The work plan is like a roadmap. It'll help guide you through a 3-year program of developing your program, implementing it, developing sustainability options, and then having a companion evaluation plan, which will help you figure out what is this program really doing? What are the outcomes? What are those data pieces that Stephanie's talking about that show you why this program is important and the impact it's making on people living with dementia, their caregivers, professionals in the dementia care world? So the grantees, something really key on this is like a roadmap that you're following, sometimes has a detour. You can make a detour on your plan and adjust it throughout the project in consultation with ACL as you need. So you can, something's not working right, you can adjust it. So this is kind of the beauty of this project where you have some flexibility as you need, which has been really helpful to grantees. As you see on this slide, some tools that will assist in work plan and evaluation plan development are included here, and we'll talk a little bit more about some of these tools as we move on in the webinar today. So on the next slide, we'll hear another testimonial, this time from Jill Sigliana of Memory Care Home Solutions, where she emphasizes how her organization developed a work plan and then they refined it. They adjusted that roadmap as they worked on their project over the 3-year grant cycle. So Shane, can we hear from Jill Sigliana now?
My name is Jill Sigliana, and I'm the program director at Memory Care Home Solutions in St. Louis, Missouri. We created an initial work plan with our submission materials, which was our best guess at the timeline and activities for our project. Then during the planning phase, our NADRC technical assistance team helped us think through some activities that we hadn't originally thought to include. So we had meetings with our program team, with the evaluation team, and with NADRC staff to refine the work and evaluation plans. And this process ensured that we had ways to evaluate each project objective and our progress toward those objectives, and that we had thought through all of the subtasks and activities under each of those objectives. And then we proceeded to just live by that plan for the next 3 years. We use the actual document itself monthly to monitor our progress internally as a staff. We used it during meetings with our grant partners. And I especially appreciated the work and evaluation plans every 6 months to help us in the completion of semi-annual reporting. So for those reports, grantees are asked to describe the activities they've completed during the previous 6 months. And those activities can be pulled directly from the work plan, especially if you've been living by it. And we did during our project have a few minor bumps in the road, which required adjustments to the work plan. So as an example of one of those, it took us longer than expected to get licenses in place and complete training for our selected evidence-based program. So we went back in the work plan, and with the help of our TA team, we adjusted just the timeline for those activities. But then we also had some major bumps in the road, like the onset of COVID lockdown during our project period. So that required us to add entirely new activities to help us meet our objectives in ways that we couldn't have even imagined when we began the project. So I think this was optional, but we took advantage of it. We continued every month to meet with our TA team throughout the project, and those meetings were invaluable. They gave us a chance to discuss modifications to the work plan and build consensus around those changes with our program officer and the support of the technical team. So I didn't know what a collaborative grant, a cooperative agreement meant before starting this ACL grant, but through our experience, we learned that it truly is a collaborative process between the grantee and the Administration for Community Living.
So we want to go to the next slide. Great. So this is some repeat information that we talked about earlier, what the state grants and what the community grants are doing. It's super important what Jill was talking about in terms of it being a cooperative agreement, having the flexibility to adjust course. You know, we all learned a lot about being flexible when in March of 2020 and over time, and certainly people are starting to get back to whatever the new normal is, but everybody had plans. We had these worked out plans that we spent a lot of time putting in place, but then COVID hit, and as life does, I mean, that was the extreme version, but we learn and then we pivot to address what we learned. And as I think Sari said, you know, having the ability to pivot as you work through it and learn is really helpful, and update these documents as we talk. You hear us talking about the work and evaluation plans. It's really important to understand that they are living documents. As we go, they change, and because none of this work is research, anybody who's our grantees always here's us saying, you know, this isn't research, so we can pivot to accommodate what life is handing us. So next, I'm going to go into some examples. I'm just going to give you a snapshot of where we're serving people through these programs, a little bit of the outputs from the ACL perspective, and then talk about a few of the activities that our grantees are doing. So next slide, please. The next slide, this slide basically shows you where we're working. As you will see, all the blue states are the ones that we've funded grants in, that we actually, I think actually this is everywhere we have active grants at the moment. The little triangles represent the diverse communities that we're also serving. We strive very hard at ACL to get resources and services to those with the most social and economic need. And through this depiction, you can see that we're working very hard at getting at Native American communities, African American, Asian Pacific Islanders, and Latinx communities. We certainly always strive to increase the number of colored triangles on our map. But at this point, this is where we are at today. There's a little snapshot on the side, and we'll get a little bit more into what the types of the profiles of the typical grantees that we have. So we'll go to the next slide. And in this slide, I just wanted to talk really briefly about the outputs of our programs, the counting. We don't focus a lot in our evaluations as much on the outputs as outcomes, because the outcomes are really the impact of our work in the communities. The outputs are the numbers just showing, showing what we're doing. So we've funded since 2013 167 grants. You've heard some talk about evidence-based interventions. Everybody's required to implement a dementia-specific evidence-based or evidence-informed intervention. So far through our grant program, our grantees have implemented 42 evidence-based or evidence-informed interventions. You'll see that we 35%, we do count some, we do what we call an information collection. And so we can collect data on who our caregivers that we serve are and who our people living with dementia are, just so we get a sense of what communities we're reaching best and where we need more. So 35% of the caregivers that we've supported through this grant program are from minority communities. 71% of them are women. Our training is a huge piece of our program as well, and getting to a more dementia capable workforce. Dementia capable is a term that we've been using for quite some time, and bringing dementia capability to homes and states and communities is sort of at the crux of everything we do. Also, our grantees are required to dedicate 50% of their total grants to providing direct service. That's the eyeballs to eyeballs work, and working with caregivers, people living with dementia, and doing the training. We've, as you see from the number here, we've provided in excess of 2.3 million hours of direct services that we have counted. I mean, certainly I would suggest that there's the time that we're counting in active grants, and then all of the activities that are sustained beyond that the grant period would make that number much, much higher. So just wanted to give you sort of the snapshot of the outputs, and know that we're continuing to build on that as we go. So the next slide is just going to give you a snapshot of who our state grantees are. Basically, we have these notice of funding opportunity. It's called a NOFO. It comes on grants.gov. You'll learn a little bit more about that later. But that is, there's a description of who the eligible applicants are for the government, the state applicants, and typically it's been, the human services departments, health departments, social services, aging and disabilities. In a couple of states, we actually have, it's the lieutenant governor's office. It's the entity within the state that is designated to address Alzheimer's and dementia issues or caregiving issues. And so that's the entity in the state that is going to apply. Sometimes they collaborate with one another. Different departments will collaborate with one another to be able to address more people, but it's really the entity that has the ability to impact the delivery of supports and services in the aging community, aging and disability community. So a lot of time you would know it as the state aging network, but they can influence those the scaling up of trainings and services across the state. With that, we'll go to the next slide. And so that was the last slide was the snapshot of the state organizations. And then this slide is about community organizations. We have our community-based entities that we are funding are those entities that have public and private. Doesn't, we don't delineate between, don't exclude one or the other. You do have to be existing home and community-based providers that are expanding your services. We're not funding people who are just starting to serve the community. We're not doing startup activities. It's really entities that have experience in supporting caregivers and people living with dementia, and have the ability to build upon whatever it is that they have already in place. The communities that we serve, very diverse, whether in location, rural, urban, suburban, or just diverse communities. The diverse communities, as I mentioned before, the Latinx, the API, tribal communities, African Americans. We have, you'll be hearing from a grantee that serves predominantly Persian communities. Anything and everyone are eligible to benefit from what we have to offer. The organizations, basically the home and community-based service providers, adult days providers have expanded programs to bring more dementia capability to their staff, senior centers, basically nonprofits serving aging populations generally, or those organizations that might be serving, specifically dedicating their work to people living with dementia and caregivers. So most certainly area agencies on aging are in our group of applicants and recipients of our grants. And with that, we'll go to the next slide. So one thing I quickly wanted to touch on is the benefits of collaboration. It is so important that whether you're a state or a community-based organization, that you have partners, because you can't hit, one organization typically can't hit all of the areas that we are asking people to address. So, finding the right partners, even if it's just to bring in more people as referrals to get services to people, having good partnerships in a community will broaden your reach. So, and there are many, so there's the grant organization and then their partners, and there's benefits to the grantee, but there's also benefits to the partners, because the partners can be people that are earlier in the phase of becoming dementia capable, and they could be they could graduate, you could say, to becoming a grantee after they've participated in a collaborative effort on a larger grant, and then becoming a grantee themselves, because they understand dementia program development and implementation and the value of evaluating the work that they're undertaking. They become knowledgeable about the things that we're doing, and that gives them the opportunity to be a more successful grantee. And so all of the benefits of collaboration, just the outcomes on the work, complement and result in the collaborators having expanded capacity to apply and receive future ACL fundings. And so the next slide, please. So real quickly, I just wanted to give you some examples of state activities, which are very broad. They are bringing resources to support caregivers, targeting in the states, enhancing the state resources and services to caregivers and people living with dementia. They are identifying and getting those evidence-based, dementia-specific evidence-based and evidence-informed interventions into the state aging network, making it possible for Older Americans Act funds to be utilized to get resources to individuals benefiting from the area agencies. They can oftentimes the state activities result in inclusion of dementia specific programming and the creation of state aging plans, embedding that kind of programming in the Title III programs. That's oftentimes a sustainability tool for programs that we test out. Then you have the data, then they're able to sustain work through Title III funding. We had one state that for many years we worked with them to help them as they created what's commonly becoming a trend of creating a dementia care specialist program. We had a webinar on that in May about the Wisconsin Dementia Care Specialist Program, and we were able to support them in parts of their development of that program. But really, this is all, in the end, it's all about increasing the dementia capability statewide of the statewide aging networks, doing that no wrong door work, and working with the ADRCs. And in the end, that's what it's really all about. So next slide, please. Just some quick examples of the community activities: education, delivering education in the local communities. A lot of people are doing a lot of dementia-friendly communities, dementia-friendly America type activities to just bring decreasing stigma through awareness building, working with again those evidence-based and evidence-informed interventions, taking them to the grassroots level, and understanding the impact of those at the community level, keeping in mind that our community programs are, as I said before, they're complex programs with a broad range of activities going on. Grantees are developing and delivering meaningful engagement programs for people living with dementia and caregivers, and they're all designed to improve the quality of life of people living with dementia and their caregivers. Supports and services for people living with dementia, and including people with IDD, keeping them in their homes and communities for as long as they would like, and as long as possible. Working with the workforce, partnering with workforce enhancement, the geriatric workforce enhancement programs, working with volunteers, like developing and launching volunteer programs, community health worker programs, and that is that's just a few things they're doing. We certainly, if you look on when we talk about the NADRC, if you look on our website, you can see profiles of our programs, and you'll be able to get a better sense of the broad range of work that people are taking. And with that, I'm going to send it back to Sari.
Great, thank you. So we're going to move into our last testimonial, hearing from Dr. Miriam Sayedi, who will talk about how the ADPI project to her organization, OMID, helped bring some services to an underserved population. Shane, can we play that testimonial, please?
Hi, my name is Miriam Sayedi. I am the Executive Director of OMID Multicultural Institute for Development. For short, we are known as OMID Institute, and we are located in Irvine, Orange County in California. We had the opportunity and the honor of getting this funding to provide service to our older adults through ACL, and that was quite an experience for us, in that we were able to expand our services that we were providing to the older adults in our community, who were primarily immigrants from Middle Eastern countries, especially from Iran, who were Farsi speaking, monolingual Farsi speaking, and it allowed us to actually provide a service that was very much needed. And we've been asked time and time again if we were able to expand our services, and this funding allowed us to do that in a very timely manner. And in this program, the biggest element, I guess, that was really very well received, and we are hoping to maintain the program, and we've had some ideas for sustainability, had to do with the caregivers, that they are under a great deal of stress often. And in this program, we are able to provide them with a great deal of resources and support, and even provide mental health for them as well. So this was a phenomenal opportunity for us, and it really helped our community tremendously. And this was an amazing collaborative effort that provided significant support and resources to a very underserved, often even I would say unserved community. And we now expanded some of that programming to the Arabic speaking, in addition to the Farsi speaking community that we were providing service to. The flexibility and the level of support that we received by the funders, and how they supported us every step of the way, that was another amazing experience for us, because we usually get these grant fundings, and the funders often are very demanding and in some ways watching over you very in a way that is not helpful. Let me put it that way. But with the NADRC, they actually has been very helpful. ACL coordinators, Erin, been amazing, and they've been kind, supportive, always available to answer questions, great for problem solving and brainstorming. So I'm really hoping that we will be able to continue working at some other capacity or in some other way with this funder in the future. Thank you for listening.
So we just have a few more slides here. So Dr. Sayedi and our other grantees who you heard from mentioned that they applied for this funding. The information on this slide tells you how to learn about the next funding opportunity. The information comes out through grants.gov, and you actually can set up alerts through grants.gov to get information on different funding opportunities that come out, including ADPI. If we go to the next slide, we mentioned a little bit about the NADRC website. This is what you'll see when you log on to the NADRC website. This is the homepage at nadrc.acl.gov. We have a multitude of resources on here: archived webinars, training materials, grantee reporting resources, and templates that can help applicants with their ADPI applications. So on the next slide, when you receive these slides in your email later today or tomorrow, you will see that these will be hyperlinked, and you can click on them to see various templates and resources that can help in an application for an ADPI grant, or can help you otherwise in programs that you have with your organization. So we hope that you'll take a look at those. And with that, we are going to move into our thank you and questions. Feel free to reach out to Erin Long at ACL or to me with any questions after the webinar that we don't get to. You can enter additional questions into the Q&A feature on Zoom right now, and Erin and I will start answering some of those questions.
So I will go first and answer the question about the connection between the CDC BOLD grants and the ACL ADPI grants. So they're obviously separate, but there is a logical connection between public health and the delivery of home and community-based services. Hopefully, our desire is that the BOLD and the ADPI grantees would collaborate with one another and not duplicate the efforts of each other. So referring people back and forth, and that's collaborative partnership relationship. We most certainly do have some public health departments that are recipients of BOLD grants that have also received ADPI grants, and that works well too in sort of they're meeting the requirements of both grants and hopefully building infrastructure in communities to serve people living with dementia and caregivers. There was two other quick questions I want to hit. The funding over 3 years is for community grants. It's a minimum of $850,000 total for over the 3-year period, with the maximum of $1 million total. And that's the federal funding. So there's a 25% match that's required with every grant. So dependent on how much you ask for, you then have a 25% match requirement that is added to that. So, and 25% based on this formula that we use of $1 million is actually $1 for every $3. So it's $333,000. So the maximum total grant award would be $1.333 million for over a 3-year period. And someone else asked if the eligible applicants are nonprofit and governmental organizations. Yes, not-for-profit organizations and entities, including universities, hospital systems, and the governmental organizations would be those state governmental, county governmental. The county governments would be eligible for the community grants. The states would be eligible. The state government entities would be for the state grants. Did you want to answer just any, Sari?
Sure, we can look at some of these questions. Someone had asked about a list of different funded entities. Erin briefly mentioned that on the website, there are profiles of different grantees from the past years. You can search on the website under the word profiles, or on the word profiles rather, and learn a little bit about some of the funded entities currently and in the past, so that should help. There was a question about, there's a few questions about the next funding cycle. Erin, do you have any information on that?
I think that the new funding cycle, I would say you should keep yourselves apprised of what's on grants.gov, but I expect something in the first quarter of the fiscal year for the government. The first quarter of the fiscal year of the government goes between October and December. So somewhere in this first quarter, we're hopeful that there will be a forecast, and then there will be a notice of funding opportunity.
Great, thank you.
There was a question here about are these different from the dementia specific 3-year grants from the federal Department? I think these are the Administration for Community Living is what's known as an operating division within the U.S. Department of Health and Human Services. So I'm assuming that these are the grants that you're talking about. I'm not familiar with any other 3-year grants from Department of Health and Human Services.
Well, someone was asking specifically about funding community organizations in specific states. There's no state that is not eligible to apply. So any state in the United States, Puerto Rico right now also has a grant project. They're all eligible to apply. I hope that answers your question.
As long as the states are eligible to apply for them, and then the community level have to be existing home and community-based service providers.
Right. So there was a question about supporting digital approaches to caregiver education and support. Do you want to talk a little bit about that? If digital, I'm assuming that also means virtual approaches to caregiver education and support are funded.
We fund our communities and our states and our communities to meet their community members where they are. So they have the opportunity to deliver the education and supports and services and whatever is their community is willing to receive. So we certainly have programs that are delivering education and services virtually and in person. So, and obviously during the pandemic, everybody pivoted to virtually. Some have come back to hybrid versions. So they have the opportunity to do whatever meets, whatever their community is willing and able to receive.
Great, thank you. Someone was asking for us to talk a little bit more about dementia capability and what dementia capable means. So one item that we didn't talk about in this webinar, but where you can find information on dementia capability, there's a report on the NADRC website, and there's also something called the Dementia Capability Assessment, which is a requirement of ADPI grantees. They must complete what we call a dementia capability assessment at baseline when they get their grant funding, and then every year thereafter and at the end of their grant period. Every year thereafter when they have grant funding. And the dementia capability assessment looks at different aspects of dementia capability, like how you identify people living with dementia, how you identify caregivers, what kinds of specialized services are provided to people living with dementia and their caregivers, what kinds of other services do you provide? And as you go through those questions, you get a sense of that dementia capability is the ability with which an organization and a system can serve people living with dementia and their caregivers, and how are you integrating dementia capability into the organization that you are part of? Erin, do you want to say anything more about that?
Nope, I think you covered it perfectly.
Okay.
There was a question here on someone suggested that the ACL's process to become an ACL evidence-based program has been suspended. That's actually not related to the work that we're doing with dementia. That's ACL. I don't know anything about them suspending it, but the ACL Title III, I think D program has a list that they add to of evidence-based interventions that meet their highest criteria. We have a very specific definition that of evidence-based, what we consider evidence-based in the dementia programs that's included in the notice of funding opportunity. You will see in one of the earlier slides, there was a link to our compendium of the evidence-based, evidence-informed interventions that have been implemented through this program. We are in no way, shape, or form dictating what dementia-specific evidence-based interventions our grantees are allowed to do. There's a best practice caregiving website that you can Google best practice caregiving, and they also have dementia-specific evidence-based interventions that would meet our criteria. But and I don't know who owns that ACL database of the broader evidence-based interventions program for the Title III.
So we're almost out of time, but I did want to make sure everyone knew the answer to this one. Someone asked what portion of the grant award is budgeted to NADRC for technical support, and the answer is you don't put any money in your budget for technical support. It comes with your package. So
Yeah,
Right.
it's a package deal.
Yeah.
There's one other question here that someone wrote that I wanted to answer.
Sure.
Are there any tribal communities currently funding? Yes, there are. We, in 2020 and 2021, funded 5 different tribal entities, meaning some specific tribes and then some consortiums. And then in 2021, we also and that was through a specific initiative on dementia capable Indian country. Then in 2021, we moved to having the tribal entities just apply with all of the other grants, and we funded a Wichita and affiliated tribes through that. So yes, we presently have 6 tribal entities that are participating in our programs.
Great, thank you so
And
much.
in community organizations in Alabama, there's a whole, just Google Panda Project Alabama. We have 3 for the middle, central, and western Alabama. They are funded through our program as well. Sorry, I just want to get that last one in.
No problem. So there are lots of questions left. I had Shane put Erin's and my contact information back on the screen so you can jot down our email addresses, and you can send us a question if you would like. We also will send out the slides later today or tomorrow. And you can respond to the email address that comes from as well if you have additional questions that you would like to ask. I do want to thank you all for participating today. We are really glad to have you all here. We will have another webinar on dementia equity programs in the Hispanic and LGBTQI+ communities. That will be December 13th from 2 to 3 p.m. Eastern Time. Please keep an eye out for the registration information that will come to you via email. And you can contact NADRC-webinars at rti.org if you need more information, and we hope to see you there. So for today, we'll sign off, and thank you again all for being here. We appreciate your attendance. Take care.
Thank you.